well. So what can endocrine disrupting chemicals do? They can either increase or decrease the production of certain female hormones. They can imitate hormones, interfere with the signaling, compete with essential nutrients. So even if we are getting a very whole foods diet, if we're still being chronically exposed to these endocrine disrupting chemicals, it can still have a negative impact. They can bind to essential hormones and then just accumulate in our organs if there is a lot of fat in them. And then downstream can lead to the developing hormonally related cancers like ovarian and breast cancer. So what can I do as a naturopathic doctor? So one of our fundamental principles in naturopathic medical school is preventare, which in Latin means prevention. So an ounce of prevention is worth a pound of cure. So first we want to start with diet. Food is medicine. So some of the basic things I like to address in my consultation is avoiding as much processed and refined foods, avoiding pesticides and herbicides, so buying organic as much as you can. And then when it comes to meat, this is huge. So a lot of it lies in the education. When you're shopping at grocery stores, focusing on pasture-raised, organic, free-range, grass-fed meats. Eating detoxifying vegetables, so that includes some of the brassica family vegetables, so the bitter, dark leafy greens such as spinach, kale, arugula, Swiss chard, and beets. And then supporting our farmers markets because they are the ones that are utilizing sustainable and organic ways of farming. So then how do we reduce our toxic load in the bodies? So there is a group called the Environmental Working Group, so you can go to ewg.org, and every year they publish 2 different lists. One is called the Dirty Dozen, and the other one is the Clean 15. So I don't know if anyone in the audience is familiar with those 2 lists. I saw a hand over there. But the Dirty Dozen is the top 12 most heavily sprayed produce in our country. So if you want to be a mindful shopper, it's good to focus on buying organic with the Dirty Dozen. But the Clean 15, those are not as heavily sprayed, so you can get away with not buying organic. So if you want to be a little bit more cost effective with your shopping, you can print those 2 lists out. Like I said earlier, eating organic whenever possible. Glass is best, so minimizing plastic usage. So when it comes to water bottles, I don't know if a lot of you use plastic water bottles and you leave it in your car. It's a really hot day, so the melting of the plastic can release toxins into the water, and then you're just being chronically exposed to that. So if you can avoid that, that's best. And then purchasing things like a glass water bottle or even a stainless steel water bottle is an alternative option. And then how to reduce stress. So when it comes to our young girls, since we live in a technology-driven society, I see a lot of teenagers constantly on their cell phones, on their iPads, on their laptops, and I don't see that many kids, playing outside anymore. So encouraging physical activity is a must. I like to actually talk to my young patients about meditation and relaxation skills. And it's best if the parents actually adopt that lifestyle first because kids are very impressionable at that age. So if they see their sibling or their parents practicing meditation or breathing techniques, then they're more likely to kind of adopt that lifestyle as well. And it can become a family bonding event. And lastly, this is huge, talking to your daughters, body image with a lot of young females is a huge topic. So making sure girls feel comfortable in their own skin, encouraging positive body image talk, and just, having that open discussion, that open dialogue is really critical. Next slide, please. So how can I help as a naturopath? So when I see my clients, I like to spend a 60-minute detailed consultation with everyone. So that will give me enough time to understand your health history, figure out how much are you being exposed to environmental toxins, what is your diet like, and then we start there with the fundamentals. So I have my patients track their food in a diet diary, bring it back after 2 to 3 weeks, and then I can make the appropriate changes because I want to meet you halfway. I don't like to throw your life upside down and cause more stress. So every patient is unique. I want to honor that and then do my due diligence. So some of the conditions I see is PMS, menopause, uterine fibroids, polycystic ovarian syndrome. All of these conditions can be addressed with lifestyle first. There is a time and place for pharmaceuticals, for surgery, for invasive testing, but if we can start with the underlying root cause, then we're getting you on the right path towards healing. So thank you. Knowledge is power. We like to see ourselves as educators more than doctors, just spreading our wisdom and knowledge to you. That way you can make the best and appropriate lifestyle changes for yourself and for your girls. Thank you.